When the American Recovery and Reinvestment Act, or ARRA, came out, and it created the high-tech program, which provided $30 billion in funding for the IT infrastructure for hospitals and for primary care physicians, they basically left behavioral health and addiction treatment providers out of that. And so we looked at how do we help advocate with National Council to go make this happen. And in conversations I had with then Congressman Patrick Kennedy, he made a point to us that there are so many different voices in the behavioral health community, whether it's psychologists, psychiatrists, social workers, behavioral health, CMHCs, what have you, every one of them coming in with a different list of priorities. And he would tell me the exact thing he said to me was, the AFL-CIO comes in and they represent everybody from aircraft manufacturers to waiters to doctors to nurses, yet they come in and they say, here's our top 3 priorities. Here's what you as a congressman need to do for us. And so we took that advice and went back and got all of the behavioral health advocacy groups together and said, let's get together in a room and speak with one voice so that we can do what groups like the AFL-CIO and other big lobbying groups have done. And it's been extremely successful. We created the Behavioral Health IT Coalition that includes all these organizations that we've helped bring a common voice to the Congress in terms of advocating for the needs of behavioral health and addiction treatment providers. It was really advocating for the safety net providers, behavioral health, addiction treatment, child welfare. How do we get them to have the IT infrastructure they need to get ready for value-based care? The same way hospitals were meeting meaningful use requirements and doctors were meeting meaningful use requirements. The foundation of that high-tech act was to build an interoperable health system for the country. And you can't build a health system if you're leaving out behavioral health, which is a huge component of that treatment of any individual. And so we needed to advocate to say this same group, this population, needs tools just like the hospitals and doctors need if we're going to communicate and address a population, especially with seriously mentally ill, with chronic and comorbid physical health problems. We need to be able to communicate and talk to those providers and share data back and forth, and you need to help us fund the ability to go do that. As we started talking to the congressman and we were looking for a sustainable funding model for behavioral health. Many of our clients were living on a grant for this, a grant for that, a grant for that. And as Linda Rosenberg said many times, if you have cancer and you're going to an oncologist, you don't want to be dependent on your provider having to get a grant to continue your clinical treatment. It's the same thing for somebody with serious mental illness. You shouldn't have to rely on grants to continue to get your treatment. So we needed a sustainable funding model. We started talking to Congress about that back in 2009. In working with Congress at that time, we created something called the Excellence in Mental Health Act. And that legislation was introduced by Senator Stabenow from Michigan. And it had the basic parameters for what a CCBHC would be. And in fact, it was Senator Stabenow who coined the phrase CCBHC. So the Excellence in Mental Health Act never got out of committee, but when the Affordable Care Act was being implemented the next year, we were able to work with our other advocates to get it included in the Affordable Care Act. And the Affordable Care Act actually created, the beginning of that was the health homes. And the health homes rolled out across states like New York and Missouri were some of the leads in it. And that created a care coordination model and a per member per month payment model to pay to do care coordination for this population with multiple chronic diseases. And so that was the beginning of it. The Protecting Medicare Act of 2014, that actually created the CCBHC. It was a legislative body that created the CCBHC program with the 8-state pilot. And really, it was in subsequent years in 2015, 16, 17, when the CCBHCs, they went through the regulatory process. They did a procurement, the CMS did a procurement with SAMHSA to select the 8 pilot states. Then they did their internal processes to select the first CCBHCs. And I think there was about 67 of those CCBHCs across several hundred sites that formed the genesis of what is now the CCBHC program. So if you look at the data that has come out of the CCBHC program and you talk to some of the original organizations that became CCBHCs, they dramatically increased access to care. The time from a call for help to your first appointment was dramatically reduced. They were able to recruit more providers because they were able to pay competitive salaries. They were able to expand the service offerings, so most of them added substance use or partnered with substance use treatment organizations. The initial review of the data showed that there was tremendous improvement in care and quality that was delivered by these CCBHCs. So then roll the clock forward to 2020 and 2021, we had a national and global pandemic hit. And that dramatically increased the demand for mental health services, big increase in substance use overdoses, and the need for depression treatment. So there was a huge demand for that. So when the CARES Act and the American Recovery Act came out, one of the things they did in that is they built in more funding for CCBHCs to expand the program. We added 2 more states in as part of that. And there was a lot of grants that went out to states that were not CCBHC states to allow them to do Medicaid waivers to help start implementing the beginning of the CCBHC program. So the tragedy with the Uvalde shootings led to the bipartisan Safer Communities Act, which added funding to roll out CCBHCs to the rest of the country. That's going to happen over the next 10 years, but it's $8.5 billion to fund the operational needs to roll out CCBHCs across the country. So that's really the beginning of the operational phase of CCBHCs.